Today, city by city, tens of thousands of people around the globe are taking part in World AIDS Day events. Their goal to remember those lost to AIDS and to raise awareness that the fight against HIV/AIDS continues. Washington Full Circle starts right now. Welcome to Washington Full Circle. I'm Furman Patterson. It began as the first ever Global Health Day. This year marks the 28th annual World AIDS Day. And even today, education and prevention remain the strongest tools in the fight against HIV. One of today's events in D.C. is a World AIDS Day Health Fair in Anacostia. Kelly Carter Knight is there.
This health fair is just one of the ways that the D.C. government is getting the word out about World Health Day that happens every December 1st. And so we're going to talk a little bit more about that with Angela Fullwood-Wood.
Good morning. We're excited this morning for our annual World AIDS Day Health Fair. This is an event that we've put on for about the last 7 years, and it really provides an opportunity for us to engage the community again in this dialogue about HIV, how to prevent HIV, and to make people aware of the services that are available here in the community, particularly in the Southeast area. Family and Medical Counseling Service, we've been in existence since 1976 and have a long history of providing HIV care. Our services started back in the early 90s, really focusing on helping African Americans to access HIV testing services in the community so that they could know their status and then getting them into medical care. As the epidemic has evolved over time, certainly we've made huge advances in the treatment of HIV, and we're seeing a much healthier population of people receiving HIV services, and we're seeing people live a long and healthy life. So our goal has changed somewhat as the years have gone on. So early on, we wanted people to know their status. We still want them to do that, but we want to look at creative ways to engage the community in HIV testing. So that's HIV testing at the Department of Motor Vehicles. We're conducting HIV testing at the Income Maintenance Center. We're in the community because now many of the people at highest risk have already been tested, and they know their status and they're linked in care. So now we're trying to reach out to those other people in the community who may not have seen themselves at risk, but may be at risk and need to get into the services that we provide. In more recent years, we've expanded our scope. We're now looking into reaching new populations. We're starting a new program that's looking to engage youth in care and services. So we're going to be increasing the amount of youth that we test in the community. We're starting a pediatrics program that is really designed to build stronger, healthy communities from birth to old age. So those are some of the projects that we've been working on in the last couple of years. And this morning is just a way that we're able to continue that work and to get the community engaged with us. So we'll be doing blood pressure screenings when people come in. We'll do some diabetes screenings. You'll be able to take a free HIV test if you don't know your HIV status. If you have any medical condition that is unaddressed or needs to be addressed, you can come up to our medical program and you can enroll directly in our primary care services that we have here. And that's for the entire family, kids, adults, everyone.
So that's good information, and we can actually elaborate a little bit more on that with Russell, who's going to talk to us more about the community and what he's doing in the community with the services and the testing. So let's talk a little bit more about that, Russell.
Good afternoon. How you doing? Well, I do testing here at Family Medical, and I think that everybody should know their status. I've happened to been positive for 18 years, and I think Family Medical has helped me a whole lot. I was actually a consumer for a long time, and the services I get here and the love that I get here is very, very good, and it has helped me live a productive life. And there's a lot of people that are living productive lives that are involved in Family Medical that has been positive longer than I have. It's just a place where you can come to, and you're going to get the love that you need. It's just not just knowing your status, but someone who cares about you and, cares about what you're doing, involved in your family things and different things. So that's why I like coming to Family Medical.
Talk to me a little bit more about what it means to be a consumer, what that actually means, consumer.
What the consumer means that if you're HIV positive, you come in for services. Now with the gamut being bigger now, you can be a consumer and not be positive. But I was a consumer because I was positive, and I came here for HIV services. As Ms. Wood elaborated earlier, that she started out with HIV services, and I was fortunate enough to come here. Actually, I'm not from this area. I'm from Chicago, and this is the area I feel comfortable at. And I think it's the people at Family Medical, Ms. Woods and others, that have made me feel comfortable here and made me feel like this is my home. But I'm still from Chicago, though.
Well, World Health Day, I believe, has been celebrated every year since 1988. How has it changed over the years in terms of your opinion about living with HIV? How is that different now than it was, say, 10, 20 years ago?
Well, like I said, I've been HIV for 18 years, and when I first became HIV positive, the medications and different services wasn't as well as they are now. So people were dying. So now, at that time, I was going to a lot of funerals. Now I don't go to as many funerals as I used to go to. And I think that's because, like I said, because of the medications and also because of services you can get places like at Family Medical.
Well, that's very good information, very good to hear, very positive way to end this interview.
Thanks, Kelly. And we're pleased to have two people that work in the community who do things for HIV/AIDS and that community in D.C. We have Sean Jane, who's with Whitman Walker Health, and we have Ron Simmons, President and CEO, Us Helping Us. Thank you, gentlemen, so much for joining us today. First of all, what's the main purpose year after year for this event, for World AIDS event? What do you think its purpose is? Ron, I'll start with you.
Well, I think its purpose is to remind people that HIV and AIDS is still a worldwide problem. It's still a problem in Washington, D.C., and people are still getting infected. So we need to be mindful of that and reminded of that every day.
And for Whitman Walker, what's the relationship been between a nonprofit like Whitman Walker and the district government in trying to bring about awareness and education?
It's been very strong. I mean, we work hand in hand with our partners at the Department of Health, with organizations like Us Helping Us, to make sure that folks are getting tested and that when they test positive, they're immediately linked to care. We work very closely with the health department. We have a mobile testing unit that goes to bars and clubs and busy areas of the city where folks can get tested for free. Those tests are provided by the health department. The health department does a great job at keeping track of where we are with the epidemic. Here in DC, we've made great progress because of the work of various mayoral administrations, including our current one, of organizations like Us Helping Us. And, you know, we're seeing the mayor's commitment today, the 90-90-90-50 plan, you know, DC signing on to what other cities and other states and countries have signed on to really make a big dent in the HIV epidemic.
Now, both your organizations have been around a long time.
Yes.
But Ron, tell us about how Us Helping Us started.
Sure. Well, we started back in 1985, although we incorporated in 1988. And we started out as a support group for black gay men who were living with HIV. And back in those days, if you were a black gay man living with HIV, you were offered all of the A-list, the B-list, and the C-list, okay? I mean, both blacks, white, straights, and just about everyone, no one wanted to deal with you. So we came together. And we taught each other, which was unique for Us Helping Us, we taught each other how to live with HIV by having a holistic approach to health, looking at the body, the mind, and the spirit. Now, back in those days, we were considered quacks, but we told people you could live with this disease if you follow a body, mind, and spirit, traditional African-American health regimen. Now, we have pills, so there was no need for that. But back in those days, there was no one saying that. And today, we have grown, I'm happy to say, into one of the largest black AIDS agency in the country, if not, no, in the country, pretty much.
Well, you were there right from the beginning.
But I am not the founder. Rainey Cheeks, Bishop Rainey Cheeks is the founder. I joined Us Helping Us. I joined the support group when I turned positive over 25 years ago. And we were meeting in his living room. And he asked me to volunteer to be the ED of Us Helping Us, and that was 23 years ago.
Hold on to that. There's so much more to talk about. We'll be right back as Washington Full Circle honors World AIDS Day. We'll be back. Welcome back. An important tool in the fight against HIV/AIDS in the district has been the active involvement of a coalition of nonprofit organizations and advocates like Whitman Walker Health and Us Helping Us. Now, I wanted to know, especially with Whitman Walker Health, how has the passage of Obamacare and the access to health care affected what you do at the clinic?
Well, it's been incredibly important. I mean, the Affordable Care Act, expanded access. DC already had one of the higher insured rates in the country. That's only gone up since the passage of the Affordable Care Act. So getting access to insurance is for the vast majority, over 90% of DC residents, is not really the problem. Folks may not know where they can go to get help with insurance navigation. We have a full team of insurance navigators, so I've encouraged folks to go to our website at whitman-walker.org to call us if they have questions about, right now is open enrollment season, but with Medicaid, Medicare, private health insurance, that's just incredibly important, because obviously if someone is HIV positive, then they're going to need to be on medication and need to get coverage for that. And also we have a new tool called pre-exposure prophylaxis, or PrEP, which is taking a daily pill to prevent HIV, and almost all insurance plans in DC cover that, and that's an expensive medication, but if you have insurance, then the cost is much less.
So is that more of a vaccination? Most people would think.
Right. It's not a vaccine. It's actually an antiretroviral medication. It's one of the pills that people who are HIV positive may take, but it's a combination medication, single pill you take every day. We have over 350 patients on this medication. It was approved by the FDA in 2012, and if people take it, it's kind of like birth control. If you take it regularly, your chances of becoming pregnant with birth control are very small. The same thing, if you take this medication regularly, your chances of becoming infected with HIV are very small. So for folks who are at more vulnerable to HIV infection, people, especially gay men, transgender people who may be engaging in sex work, sharing needles, this is a really important intervention for them.
And that's exactly what World AIDS Day is about. It's about getting out that information about things like that people probably won't read on billboards, they may not read in the newspapers or hear on the news. Ron, you were talking earlier about the stigma that was attached to having HIV/AIDS back then. What are the challenges today with that so-called stigma?
Well, the stigma is still there. Although it's not as bad as it used to be, but it's still there. So you still, people who are HIV positive, a lot of them are afraid of family, friends, someone, their employer finding out, and what that can mean to both their, children have been known to be thrown out of their houses if they came out being not only gay, but HIV positive to boot. So it's very important that we deal with the stigma, that we embrace people regardless of what they may have, because they are people and they deserve the love as human beings. And not take the attitude of, well, how did you get like that, or why? No, that's not important, because this is a disease. The same way a person who catches a cold, you don't turn away and throw out your house because they have a cold, you don't turn out someone because they're HIV positive.
Perfectly put. I wanted to talk about people in the district who have family members with HIV/AIDS. It's something that affects not just that person who has it, but families and sometimes communities. What does Whitman Walker do that sort of helps guide people through that, or make them aware of how wide the circle is around that person?
Absolutely. So we have various support groups. We have peer support groups for folks who are HIV positive. We have a +1 program, so they can get in touch with someone else who's positive, and can kind of guide that. They can kind of guide that person through what it's like to be positive. So we have a variety of services. We have group therapy as well. We have individual therapy, but we also have group therapy, and we really encourage, just like supporting someone who has diabetes, someone who has high cholesterol, someone who has a chronic medical condition, which is what HIV is today, that folks really encourage people who are HIV positive to stay in care, to check in on them, but to not judge them and to not pass judgment. And Ron was talking about the stigma, and that's we look at what Charlie Sheen, when he disclosed his status a few weeks ago. He had to pay $10 million allegedly to keep his status from coming out. if he had cancer, if he had any other kind of medical condition, there's just that stigma around HIV is such a singular, unique aspect of HIV, and it's what it contributes to HIV continuing to be an epidemic, not only in the U.S., not only in DC, but worldwide as well. So family members, friends, colleagues can play a huge role in ending that stigma.
And we've seen both your organizations, as a Washingtonian, native Washingtonian, I've seen both the organizations grow over the years. And we'll talk more about yours, but I know you even own the building that you operate, you bought and purchased. How unusual was that?
I think, frankly, we were the first gay identified Black AIDS agency in the country to buy our own building.
Wow.
But I want to say that one of the nice things about DC is that all of the agencies indeed work together. We work with Whitman Walker Health. We work with Family Medical Counseling. They work with us. We provide HIV testing also, Hep C, hepatitis C screenings, STD screenings, case management. So if indeed you or loved one you know are dealing with the issue of HIV, you can come to us, helping us. We in turn will send them for medical care to Whitman Walker Health or some of the other agencies or clinics in the city. But we work together so that you really have a safety net. We have support groups. We have people who are having a hard time dealing with a treatment and staying faithful to treatment. So we have a treatment adherence counselor. Those kinds of things all together, working with other agencies. We really give housing. We help with housing if we can. So this is not the way it was, and I'm looking back now as somebody who's been positive for over 25 years. The difference between then and now is like night and day.
God, there's so much to talk about. We have a little more time left. For a complete listing of local events and activities honoring World AIDS Day, this week visit DC Department of Health's website, doh.dc.gov. Welcome back to Washington Full Circle as we recognize World AIDS Day with two organizations united in DC's fight against HIV/AIDS. And so we were talking about the growth of Ron's Us Helping Us, but we've seen Whitman Walker grow from a smaller place on 14th Street to what it is now. Tell us about the growth.
Yeah, we've hired actually about 100 new staff this year. We're at about over 230 employees. So we joined forces with Metro Teen AIDS earlier this year as well. And we opened our new health center on 14th Street, right next to Studio Theater. 14th Street has been our home for a very long time, for decades. And so for us to continue to have a presence there, it's very accessible for our clients. Folks come from all over. We have patients coming from even West Virginia, from even further away. The fastest growing patient population for us is transgender people. And because we offer culturally competent medical care, dental care, aesthetic services, behavioral health, addiction services. And so trans folks from all over the Mid-Atlantic region come to Whitman Walker for those services. So the new health center, Ron was talking about, back in the day, the importance of treating the whole person, especially before we had effective treatment for HIV and AIDS. In some ways that's still true today. And we at Whitman Walker really believe in it's not just about giving someone pills. We have a pharmacy, and of course we do that, but it's about, ensuring that their mental state is good. It's about helping them out with whatever other issues, whether it's an addiction issue, whether it's dental issues, whether it's issues that they're having, and really working with them to in a holistic way. So this new health center really helps us do that in one place.
Yeah, and it's prime real estate.
It is. Yeah, it's wonderful. We love being there.
Yeah. You were recently recognized in a magazine, and it's not the first time. Tell us about that.
I'll tell you. Well, I was selected by Paz Magazine as one of the Paz 100. This year, they selected me because I'm a long-term survivor, meaning that I've been around for over 25 years with HIV. Back in 2010, I think they gave me the honor as one of the 100 most influential AIDS activists in the United States. So it's nice to be thought of that way. But I just want to talk about one thing. Us Helping Us is a freestanding mental health center clinic. So indeed, if you want counseling, particularly if you're a black gay man, because that's our specialty, although we serve everybody, transgenders, men and women, heterosexual, and youth. But if you're a black gay man, we were founded to serve you, and you are who we specialize in serving. So you can come and talk to us about anything. I mean, we have counselors that are heterosexual, homosexual. Our main therapist has a gay son. She understands. She's a black woman with a gay son. It's like talking to mom. Okay, so call us at 202-446-1100.
Now, you're a nonprofit. We understand there's a long history of Whitman Walker, but how are you funded? How do you raise funds for doing what you do?
Well, most of our funding comes from the government, from either the CDC or the DC Health Department. We're also funded by corporations like Gilead or ViiV. However, a large part of it is individual donations. We are a member of the DC1 Fund, so if you're a DC employee, our number is 9911. Please go on and give us a donation. And you can always go to our website, uhupil.org. That's UHUPIL, for Us Helping Us, People into Living.org. Go to our donation page. Please send us. We are tax deductible. So, and that's how really agencies like us survive. I mean, clinics, they have doctors and they can charge. Right. But agencies like ours, we really need those individual donations to make it. So not only us, but other, like the Wanda Austin House and others that are small agencies that are struggling, we need the support of the public.
Now, from years ago, and looking ahead to now, the president is signing legislation, the mayor is signing legislation. Did you ever think that it would evolve from the stigma and not many places to go to what's happening today?
It's been such a quick, in some ways it's been quick, in some ways it's been 35 years, you know, I mean, and I'm 30 years old, so, but it is remarkable that, especially in DC, you look at the new cases being at just about 500 a year. You look at how people who are HIV positive can live, you know, just as long and healthy lives as folks who are HIV negative. And the treatment, you know, keeps getting better and better, and there's new treatment options coming all the time. So, you know, it is changed. In some ways, it's like the LGBT movement, where there's been such kind of rapid change. We see that as well with HIV, but you know, at the same time, it's kind of, we still have a long ways to go. And I think that this is a great day for us to take stock of how much progress we've made, but also, you know, there's still, especially globally, I mean, in the US as well, but especially globally, there's millions of people who need treatment who aren't getting it. And that's a real shame, because we have the medication. And it's really just about the investing in that, and especially in the South as well, in the U.S. And D.C. less so, but in the Deep South, that's where you're really seeing HIV becoming an even bigger issue.
Why do you think that is, Ron?
Well, that's because they don't have services. You know, I mean, that D.C. is an open city. You know, you can be gay here and not worry about whether your neighbor's going to say or your family's going to say. Whereas if you're in some place like Mississippi, the doctor may be 10, 20, 30 miles away. Who are you going to tell? You know, everyone knows your business. There may not be a local agency, so it is much different. By the way, I just want to add one thing. One difference that we've seen, though, dealing with HIV now, particularly in terms of black gay men, is that it's no longer a question of individual behavior. There was a study done in DC in 2010. We found that black gay men were 3 times more infected, but they're using condoms 50% of the times more than whites or Latinos. And what we realized is that it's because of the odds. That basically, because black gay men are a much smaller population, the odds of you, we estimate that in DC, the odds are 1 in 3 if you're black gay man.
So much information. Thank you both for coming. That's it for Washington Full Circle. Thanks to our guests for joining us. Thanks to you at home for watching. We'll see you again next time.